Good afternoon, everyone. Welcome to the weekly webinar, April 25th, our last session of the month. And it's been a month full of, I think, lots of great information and resources, and that will certainly continue for today. Please make sure that you are muted so that we won't have any background noise with our speaker. You can use the closed caption feature at the bottom of your screen if you need that, and we are recording. So this webinar will be available for future watching and rewatching. And with that, I will welcome our speaker for today. Dr. Jennifer Vilwak is a fellow of the American Academy of Otolaryngologic Allergy. She is from Muskogee, Oklahoma, and attended Muskogee High School and the University of Michigan, and her journey has been marked by excellence. If you have not had a chance, click on the link in your My Alliance email to read about Dr. Vilwak's accomplishments and achievements. She has expertise in allergy management. She's committed to teaching, a dedicated physician, and a recognized leader in her field, having earned an accolade such as the esteemed Rainbow Award 2020. So we are super lucky to have her with us today. And today's topic is smell and brain health. And I've been waiting all week to say this, the nose knows. So with that, Dr. Vilwak, thank you so much for being with us today. And I will turn it over to you.
Yeah, awesome. Can you guys hear me? My headset was having some issues, but okay.
Yes.
All right, awesome. Well, thank you so much for that kind introduction, and hopefully I will be presenting some information that is of interest and, perhaps actually directly relevant to some of y'all's lives. So I'm going to share my screen. I promise not to bore you with, 10,000 different slides, but hopefully you can see my PowerPoint. Does that look like some PowerPoint stuff? All right. And yeah, the reason that I care so much about this topic is that, yes, the nose does know, and where the nose goes, health goes as well. And so I'm just going to present a little bit of information kind of about what we know about sense of smell and brain health and aging, and how all of those things are linked together, and how we can do things like test sense of smell as a window into the brain that might help us better understand different disorders, as well as how we might diagnose them early and potentially treat them earlier as well. And so just a couple of disclosures. As part of my work at KU, we've made a new smell test. So that's that patent pending first bullet point there. And then my research on this is supported by the National Institutes of Health. And so whatever I say here represents my opinion and not that of the government. I think that a lot of us have a very visceral understanding of how important sense of smell is. And around the holiday season, especially, I think we all have senses and scents that kind of remind us of grandma's house or a particular meal or something that's meaningful. And I think that's really summed up nicely with this quote, that nothing is more memorable than a smell. So one scent can be unexpected, momentary, and fleeting, yet conjure up a childhood summer beside a lake in the mountains. And beyond that, we also know from a lot of compelling data that brain health kind of follows the nose. And there's a number of different disease states where sense of smell is impacted, and often it's impacted very early. So examples of that do include things like dementia and Alzheimer's disease. But we also know that there can be other conditions. So COVID, I always joke with people that COVID made olfaction cool. Before COVID, there were not a lot of people like me studying it. But we know that this can have drastic impacts on people's quality of life. And there's a lot of folks, myself included, who are really wondering, well, what's going to happen with all the folks that did not regain their sense of smell after COVID? And what does that mean for their long-term health? And you don't have to take it from me. Several years ago, Dr. Oz actually had a show where he was talking about a smell quiz that you could do at home because of this very strong link between brain health and your sense of smell. So I wouldn't recommend necessarily these products that are shown here, but it does show and demonstrate that this is something that people have talked about for a while. And so why is it so important in our daily lives beyond just being a window into our brain? It's something that we use to detect hazards, right? So is this piece of fruit something that we should eat, or should we just let it be on the ground? A lot of things have scents impregnated into them so that you can detect hazards better. And natural gas is a good example of that. They actually put a scent in there to make gas leaks detectable. And because of that link between sense of smell and memory and conjuring up, those old memories as well as kind of bringing back those experiences, there's a lot of money that's actually spent in marketing to make sure that your brand has a particular smell. And for folks that are trying to sell you stuff, they want that smell to conjure good memories of you purchasing stuff so that you want to purchase more. And believe it or not, it's a multi-billion-dollar industry. One of the things that I see most commonly in my patients that have issues with their sense of smell, of course, things like the hazard detection can be an issue, but people really bring it up in the context of food. And the reason for that is that I think anyone who's had, a bad sinus infection or a bad upper respiratory tract infection, we all kind of know that, like, yeah, when you can't smell stuff, taste isn't really all that great either. And the reason for that is for your brain to perceive the flavor of something, you typically need two inputs. So one is the taste, and your tongue's going to tell you that. So that's going to give you information like, hey, this is salty, or this is sweet, this is sour, this is bitter. But if you want to get the nuances of flavor, and this is why when you see like the wine sommeliers who are going to tell you like, oh, this is an old world wine with hints of apricot. I'm just making these things up. So if you are a wine sommelier and those descriptions are not correct, please forgive me. But if you want to have those nuances of flavor, you need not just that taste input, which is going to tell you in very, vague terms, salty, sweet, sour, but you also need the olfactory or the sense of smell input to give you those aromas and complete that profile in your brain so that you can say, not only is this sweet, but this is sweet like apple, versus this is sweet like strawberries. And for a lot of us, the reason that we so enjoy food is because of all those nuances and flavors. So a lot of folks that have issues with their olfaction have issues where maybe they don't enjoy food as much anymore, or they can never satisfy a craving because they never get the flavor that they're craving, no matter how they eat or how they, spice or otherwise flavor their foods. And so that brings us to, well, what exactly is it that causes people to have olfactory dysfunction or issues with their sense of smell? And so this is a picture from the Harry Potter villain. You can probably see like his nose doesn't look so normal. So maybe he's not breathing so good. There's not a lot of nasal airflow. So that's why maybe he would have some olfactory dysfunction. And I put a picture of garlic here because there are some people who are just born not able to detect certain scents. And some of those scents are related to things like onions and garlic, but they can smell everything else. But for most other people, when I see patients who have issues with their sense of smell, I'm thinking that something's going on the smell superhighway. And so what happens when you inhale an odorant is that it binds up with some of these odorant binding proteins, and that information is presented to your sensory neurons, who then travel up through a plate of bone that has a bunch of little holes in it for the nerves to travel through. And then it gives this information to your brain. So if there's inflammation on the nose side of things, like if you have a lot of sinus issues or a bad upper respiratory tract infection, you can get some olfactory dysfunction. But you can see that these neurons go directly into the brain. So if there's something going on in the brain area, something like, a traumatic brain injury, Alzheimer's disease, et cetera, we know that we can get issues with sense of smell for those reasons as well. And so when I think about olfactory dysfunction overall, we know that lack of awareness is pretty common. So sometimes people don't notice it until, everybody else in the car can smell skunk except for them. But it can, as I mentioned, have a huge quality of life impact. For a lot of people, it can actually influence their employment, et cetera. And as I mentioned, it can be associated with a number of different medical conditions. And as an otolaryngologist or an ear, nose, and throat doctor, I know that sense of smell is also very strongly linked with other special senses. So those are things like hearing, the vestibular system, which is basically If you look at this pretty picture in blue here, it's this very elegant, delicate, fluid-filled system in our middle ear that helps tell us, well, where are we in space? Are we moving? Are we not moving? And vision as well. And so all of these are very closely linked. And the reason that that matters is because these sensory issues, a lot of them can be improved with training. And so when I think about how a lot of these systems start to not function as well as you age, I wonder, is this really part of what we would consider quote unquote normal aging? Or do we have an opportunity to do some intentional training, just like you're supposed to exercise and weight train, et cetera, throughout the course of your life to stay as healthy as possible? Maybe we should be retraining our noses so that we can smell things better. Maybe we also need to be retraining our balance system so that that system stays as healthy and active as possible. And the same thing for hearing. This can be aided with things like hearing aids. And there's evidence to support that training these systems not only helps you to still be able to have better use of those senses, but can also be protective against things like cognitive impairment. And so because I dabble mostly in olfaction, I'll just show you a couple of cool studies here. So what this study is showing is functional MRI, which kind of shows how active different brain regions are. And what they did is they compared people who had a normal sense of smell as well as those who had an abnormal sense of smell, and they had them do training where they would intentionally inhale these known odors and consciously reinforce, like, okay, brain, this one's lemon. All right, here comes rose, etc. And what you can see from before and after, so more dots is better, and more lines between the dots is better as well. And so from before, you can see where they started. And when you compare that to where they ended, there was a lot more functional connectivity and a lot more activity just from olfactory training. And I always joke with folks, because a lot of people do brain training games nowadays. So this was a study that investigated that same olfactory training method versus Sudokus. And I'm a person that doesn't like Sudokus. So I was very excited when I saw the results of this study, which showed that the olfactory training, these are just fancy words for different things that were tested, but the olfactory training improved their sense of smell performance, and that's what that threshold and discrimination means. But it also improved multiple things that were tested in the cognitive testing as well. So their verbal fluency improved, their depression got better, their cognitive age decreased. So all of these things, go towards, again, how the nose knows and how improving the performance of the nose can improve a whole host of other things. So you might be wondering, well, what more are we doing at the University of Kansas in some of our ongoing clinical research? And so I mentioned that we have a patent pending for our aroma test, which is the Affordable Rapid Olfaction Measurement Array, which is something that we developed at KU. And we've been using this to try and detect patterns in the way people respond to being presented with all these different odors, and can they smell it? Can they not? Can they identify it correctly or not? And using some fancy stuff like machine learning to see if we can predict, if someone is cognitively unimpaired or normal, if they have mild cognitive impairment, or if they've been diagnosed with Alzheimer's disease. And that's exactly what some of these pictures here on the right-hand side are showing you. When we have our healthy elders in blue, they're doing better at every concentration and overall versus our folks with mild cognitive impairment who are in orange, and our folks with Alzheimer's disease who are down here in gray. And that's true basically at every concentration. That's what this 1x, 2x, 4x, and 8x, the concentrations are just getting higher as those numbers increase. And what we also showed in that study is that we could pretty accurately predict who was going to fall into which of those clinical categories just based on using their smell data. And so one of the things that we're doing now is that we're actively studying this to see if we can continue to predict how people are doing in terms of their cognitive performance based on their smell testing results. And we're also wanting to know if the smell testing results can accurately predict, other things like biomarkers that you can get from blood draws, as well as how people's brains are looking on MRI. Because if we can accurately predict kind of who's at risk or who might need more intensive interventions or be eligible for clinical trials using a smell test that's done non-invasively, that could be a real game changer for brain health and identifying people who might want to participate in studies with us. So if that sounds like you, feel free to reach out to me or my study team. You can scan the QR code that's here on the screen, or you can reach out to Robert, who's my clinical research coordinator, or me. My contact information is on the next screen. But I would be happy to take any questions about olfaction, especially I know a lot of times people have questions in light of COVID as well, and that's something that we study too. So I'd be happy to, add whatever value I can to the discussion about olfaction and brain aging and answer any questions that you might have.
Excellent. Thank you, Dr. Bilwak. I realized I forgot to remind folks they could use the chat or unmute themselves while we're here today. So you all feel free to do that. You have a priceless opportunity here to ask the expert about smell and brain health. And while you might be thinking of your questions, I'll give those of you who are on this webinar a little hint. In light of what our presentation has told us about smell and cognitive improvement and Sudoku, maybe the Brain Booster in next week's issue will explore some of that. We'll see. That's a heads up for you. I just thought of that right now, so we'll find out on Monday, and then you can pat yourselves on the back for improving your cognition and your sense of smell.
And I'm not saying not to do Sudokus if you like them. They will not harm you, but for Sudoku haters such as me, I read the results of that study with much relish.
Yes, yes. Oh, there's a question in the chat, Dr. Bilwak, if you want to address that, please.
Yeah, absolutely. So the question, in case not everybody can see the chat, is would you give examples of olfactory training? Yeah, so most of the folks that are doing olfactory training, like if you read the studies, it's usually a 6-month protocol where twice a day you would be smelling different things. And so what we use at KU in our studies is essential oil dilutions. And so if this is something that you wanted to do at home, you could just get essential oils. You could also use, like household products like coffee grounds, for example. What I do not recommend is don't just use things like bleach, or other like chemicals. You want to make sure that what you're smelling is an accurate representation of the thing that you're trying to smell. And then you do it twice a day. And while you are smelling it, you're also consciously, recalling, especially if you have an olfactory loss, you would say, okay, here's lemon. And even if you don't smell lemon at all, you're going to remember like, okay, brain, remember the last time we smelled lemon? This is lemon, here it comes. And it sounds really funny, but we know that all of our special senses, there's a conscious and an unconscious component. Just like right now, if the volume's on, you can't choose to not hear what I'm saying. You can choose not to pay attention, but there's still going to be some processing of that information. And it's kind of the same thing with sense of smell. So we're trying to reinforce that conscious component. In terms of the number of things you would want to train on, I would recommend at least 4 things. Classically, it's been lemon, rose, eucalyptus, and clove. But you just want to make sure that they kind of represent a variety of different things. So like a floral scent, more of a spicy scent, an herbal scent, etc. So you're kind of capturing all the different categories as you do your training. And there are commercially available smell training kits as well, if you'd like to go that route.
I have a comment.
I think, Deborah, if that was you talking, I think you're muted. Yeah, there you're back.
Okay, there we go.
Okay.
I've lost my sense of smell and taste. And it wasn't due to COVID. My father did not have a sense of smell or taste later in life. And I can't smell or taste hardly anything, just dark chocolate, I can a little bit. But and I've been diagnosed with MCI.
Mhm.
And this study is very interesting to me, or whatever you're doing. And I don't know where to get some more information.
Mhm.
And
Yeah, we
would it, help me at all? This training thing is kind of unique. I didn't know you could do that.
yeah, you certainly can. And so most people, when you mention kind of this family history of things, it puts a couple thoughts into my mind. And Dr. Tina, she put a number in the chat to call to learn more about the study. And even if you're not eligible for the study, I think that you may still benefit from olfactory training, and our team can give you more information about that as well. But when we think about olfactory loss, especially if it runs in families, there are certain conditions or syndromes where olfactory loss is part of it. And for some, just to give you an example, there are some folks where part of that syndrome is their olfactory bulb, which is like that first relay where those nerves kind of go once they go from the brain through that, or from the nose through that bone into the brain. For some folks, that area that doesn't exist, but for those folks, we would expect for them to have never had a sense of smell during their whole life, as opposed to, having a sense of smell and then noticing that it declined and kind of petered away. So as long as you've had a sense of smell at some point, we know that structurally that stuff is there, and maybe we could try to upgrade the software, so to speak, by doing the olfactory training. And, it's not invasive. It just takes some of your time. So if you're willing to invest some of your own time and effort into it, then I think that might be something very low risk that you could potentially try.
Well, that sounds very, very intriguing. I think I will pursue that.
Yeah.
Should I pursue the study, or should I pursue the training, or what?
Yeah, if you know that right now, like this is something that kind of runs in your family and you don't have a sense of smell at all, you're not going to be eligible for our study. But like I said, if you reach out to us, we can give you our information about the training protocol and what we typically do, and then we can go about things that way.
Yeah, I've had smell, and it's just very gradually gone away. And now at my age, it's gone.
Gotcha. Yeah. And
Thank
sometimes
you.
it can be helpful. It can be helpful too to get plugged in, with our research and infrastructure, because we can actually test your sense of smell. Like I've had a number of patients who have come in and said, "Hey, I don't have any sense of smell." And we test them and we find that there is what I call some olfactory reserve, meaning there's some amount of residual function that's still there, which gives us a lot of hope for, well, maybe we can train it. Just like if, you've had some sort of physical injury and there's some amount of bicep muscle that's still working, it's like, okay, we can try to retrain that muscle to be stronger, etc. And then
Thank you.
I see a question about smelling scents that aren't really there. Yes, that can happen. And so there's a couple of fancy words for that. So one is phantasmia, and that basically means phantom smells. So that would be like, yeah, me and you were sitting in a room, I smell nothing, and you suddenly smell a whiff of, X, Y, or Z thing. That can be linked to some other neurologic conditions. I think the person here is referencing Lewy body dementia. That can be the cause. That it can also be caused by things like brain tumors, etc. So I think if you're having phantom smells, especially if you haven't had, things like COVID that kind of can run amok in your olfactory system, it's definitely worth, talking to your care team about that and potentially seeing if they want to do, some imaging of the brain to make sure that there's nothing to be concerned of there. Another kind of fancy medical word that gets thrown around, especially in the context of COVID, is parosmia. And so that basically is an abnormal perception of smells. So maybe we're all in a room, everyone except for the person who's impacted with the parosmia is smelling, flowers, but the person that has the parosmia is smelling like moldy cigarettes. Yep. That is something that happens and can be very prevalent in people who have lost their sense of smell because of a virus. That is usually worse in the first 6 to 12 months after that viral injury. It typically gets better over time. We have some preliminary data to suggest that it can get better quicker if you do olfactory training and kind of help your olfactory system reboot. But just to put that out there for those that are interested in like, well, what if it's not so much that you can't smell, but you're getting like these extra smells that don't belong? Those are things that we think about as well. Yeah, so I see a question here that says, are you saying that when your olfactory sense improves, the level of NCI may improve? So this is not something where we have like slam dunk definitive, like 100% yes answer to this, but there is emerging data to support that, yes, if we can get olfactory perception improved, that it can improve these specific measures of cognitive health. So what remains to be seen, is kind of, well, what then is the ideal protocol? Is this something that, you just do for a couple months and you get lasting benefit? Do you do it longitudinally? How long do these benefits continue? But there are a number of studies and many more ongoing to study that link to better define that.
All right, everyone. Any other questions or comments? I was really fascinated by the idea that smell and hearing are linked. And I've always kind of had some idea about hearing and balance. And of course, all of our senses work sort of in concert with each other. But smell and hearing was absolutely a new one for me. So thank you.
Yeah, we did an interesting study about that, just investigating sensory performance in folks that came into our ear, nose, and throat clinic just for a hearing test. And yeah, it was very striking to us. So when we think about, so odds ratios are one of the ways that we report results, just to see how much different things are associated with one another in terms of if you have XYZ thing, what's your risk of also having this other thing. And so when we studied people who had multisensory dysfunction, meaning that their sense of smell was off, their hearing was down, and their balance was off as well, the odds ratio was 15.7 for those folks also having MCI at that time, versus if only one sense was impacted, the odds ratio was 5. So what that means for me is someone who wants to help people age healthfully, throughout the whole of their life, is that there might really be a lot of opportunity to do all the sensory rehabilitation and training that we've mentioned to try and drive down that risk and improve cognitive outcomes long term, which is some of the stuff that we're actively studying right now on my team.
Wow. Excellent. Thank you so much. And just goes to show how we might be the KU Alzheimer's Disease Research Center, but there's so much more to understanding our brain health. So thank you, Dr. Vilwalk. Oh, it looks like there's another question in the chat.
Yeah, so this question is there any training for hearing level improvement? And so I'm not aware of any training for kind of more attention towards hearing, but there is a lot of data to support the importance of, if you know that you have a hearing loss and you qualify for hearing aids, to go ahead and get those so that you're not missing out on all the auditory stimulation going on around you, and how that's good for brain health overall.
Perfect. Thank you so much, everyone. Thank you, Dr. Vilwalk, for sharing your expertise. And right now, at least in Kansas City, it's kind of terrible weather. It's not going outside and sniffing weather. But next opportunity that you all have to go and smell something lovely, I'll encourage you to take us up on that. We'll post the video from today online shortly so that you can review and look at those beautiful slides, especially that first one with the mountains and the lake. That was fantastic. So we'll make that available. Next week's topic is going to be, we have a speaker named Cleo Childs, who was the caregiver for her mother with younger onset Alzheimer's disease, and about that. So that will be next Thursday, May
Kelly,
2nd. Yes.
Kelly, you cut out, so I
Uh-oh.
don't think people caught what you
People
said.
don't know what I was going on about. Okay, so I was
Nope.
talking about next week's speaker, who is a woman named Cleo Childs, who is a caregiver, who was a caregiver for her mother with younger onset Alzheimer's. And she has written a book called Moving With, and it's a book of poems about caregiving. And it's specifically moving with rather than moving on. And I won't say any more. I'll let Cleo tell us about that next week. But that will be next Thursday, May 2nd, same time, same place. And stay tuned to our My Alliance newsletter for more exciting news and advancements in brain health. Thank you, everybody, for being here, and we'll see you next time. Bye.